I'm Michelle Thurlman, the coordinator for the Medical Laboratory Technician program here at Maysville Community and Technical College. I'd like to welcome you and thank you for your interest in the Medical Laboratory Technician program. Each fall, 12 students are selected and admitted for the Medical Laboratory Technician program on the Maysville campus. Medical laboratory technicians are in high demand. There's about 20 to 25% job growth expected over the next decade due to many laboratory professionals retiring and leaving the career. So this opens the doors for an increased need for graduates in medical laboratory science programs and technology programs. So the average starting pay is about $15 to $18 an hour. The clinical hospital setting is not the only setting where medical laboratory professionals can work in. Veterinary labs, reference labs, pharmaceutical labs, physician office labs, those are all other opportunities where medical laboratory technicians can work. Now, the program consists of 4 semesters once you are admitted, and we'll talk about the different courses that are involved in the program. But the paperwork that you're going to need to return with your signatures can be found on the MLT webpage, as well as the informational paperwork that I am going to discuss with you today. Now, this will count as your pre-admission conference attendance, and there will be a code at the end of this video that you will have to record, which is as documentation that you have watched the video and attended the pre-admission conference. So first off, I'd like to discuss the program mission as well as objectives. So Medical Laboratory Technician program will prepare students to play a vital role in the local healthcare delivery systems and become adept in collecting as well as analyzing medical specimens for medical diagnostic purposes. 70 to 80% of all lab tests are used in diagnosis of patients. So we play a very, very important role in the healthcare system. And we also have minimal patient contact, which is usually what attracts students to this field. I know it attracted me as a student because I wanted to play a role in healthcare and help patients, but I did not want to do a lot of hand-on patient care. So this career suited me perfectly. I worked behind the scenes. I was still contributing very important information to help patients in the hospital setting. So I've really enjoyed this career, and it has led me to different options like education that I would never have imagined finding myself in. So our program objectives are to prepare you to work within that clinical medical environment, perform laboratory tests in all areas of the laboratory, so hematology, clinical chemistry, serology, urinalysis, blood bank, microbiology. All of those are different areas of the laboratory where you will learn to perform testing in. You'll also learn to maintain lab materials and equipment, prevent and detect technical errors, solve problems as they occur, carry out an established QA program, demonstrate professionalism as well as responsibility to your duties, follow safety guidelines in the clinical laboratory, follow institutional policies, apply principles of medical ethics, demonstrate satisfactory working relationships with your peers as well as any instructors, whether it be in the student laboratory or in the actual clinical setting. Exhibit enthusiasm and initiative towards all subject areas, and recognize your own limitations, seeking help when necessary. There's also our statement of non-discrimination. We do not discriminate on the selection process for candidates based on race, color, creed, gender, age, marital status, national origin, or physical and mental disability. So that is an informational sheet for you. The next form is a student data form, and this will need to be completed and submitted as part of your application. It asks for some personal information as well as why you are here, whether or not you're a current student. So you want to make sure to complete that and return that form as part of your application process. Now, the next form is an informational sheet about our program. So it tells you a little bit of information. We do require a 2.0 GPA or better to be considered for admission to the medical laboratory technician program. You also have to have completed all the admission requirements for the college. So if you're not a current student at MCTC, then you will need to go online, apply, and complete your admissions requirements with the college in order to be considered. Attendance at a pre-admission conference, which is what this video will count as. Remember, I'm giving you a code at the end to make sure that you watch the video all the way through. May 1st is the deadline for applications unless we have additional openings or have not filled all of our 12 slots. Then applications will be accepted up until all of those 12 slots have been filled for admission in the fall. Now you will also notice we do prefer that you have a grade of C in all of your math and science courses. That's preferred. It's not required, but I do recommend it because it is a very good predictor of how you will do in this program. Now on that form, you'll see our curriculum, which includes the general education and support courses, English 101, Math 110 or higher, which will need to be completed prior to beginning the program in the fall. The math is a requirement for the general chemistry course, CHE 140. So you will need to complete that math prior to being able to take that chemistry in the fall if you have not already had the general chemistry course. You can take communications. You can also take a computers course. We require a heritage, humanities, or foreign language, general psychology, Psych 110, and basic anatomy and physiology, which is Bio 135, or you can take Bio 137 and 139, which is A&P 1 and A&P 2. So it's Bio 135, or you can take both Bio 137 and 139. And those are the requirements. And remember, Math 110 has to be completed prior to starting the program in the fall, because it will be necessary for you to get that introductory general and biological chemistry in. Our core courses in the program, we start out the first semester, applied phlebotomy is the first 8 weeks. The second 8 weeks, you will have your phlebotomy clinical experience. You will also have intro to clinical diagnostic micro that first semester. So still allows time for you to get some of those general education requirements in if you still need them once you're admitted to the program. The second and third semesters are full-time loads. You will have a full-time of MLT courses the second and third semesters of the program. So the second semester, you take your analysis, you take serology, clinical diagnostic micro 1, fundamentals of hematology, and introduction to clinical chemistry. The third semester of the program, you will then have clinical diagnostic micro 2, immunohematology, clinical hematology, and advanced clinical chemistry. So pretty much advanced courses in all of the topics that you had in the second semester. The final semester of the program, you will complete 2 clinical practicums. They are 5 credit hours each, which breaks down to about a total of 600 clinical hours that are required. This is where you will work side by side in a hospital lab, learning from the technicians and the technologists on the bench, and get a ton of hands-on experience. A lot of students, this is where they have job offers before they graduate, because it's just like a long interview. The site will be able to see how well you work with others. They'll be able to assess your work ethic, whether you catch on quickly or not. And so a lot of the students I have will get job offers prior to graduation. And the Medical Laboratory Technician Program is accredited through the National Accrediting Agency for Clinical Laboratory Sciences, or NACLS. Now, on the back of that form is a selective admissions assessment. This is for your information only. So it shows you what we look at when we're considering you for admission. We look at all the previous college courses you've had. So how many of those general education courses have you completed? I also look at your math and science grades, and you can earn points for those. We look at GPA, whether you've completed all of your coursework with us here at MCTC or not. If you do have healthcare work experience, you can get points towards your application. There is another form to fill out for that as documentation if you do have healthcare work experience. We also look at ACT scores or other test scores if you have them. So those are all things that we look at when we are evaluating an applicant for admission to the MLT program. It is selective admissions, so I review all the applications and make recommendations to the Selective Admissions Committee. And again, that point sheet is for your knowledge, for your information only. The healthcare work experience documentation form, if you do have healthcare work experience, you can complete that for a few points towards your application. It does require signature from someone in HR at that facility where you have worked, where your experience is, and it has to be paid experience. So you can submit that. You don't have to have healthcare work experience. This is not a requirement to be admitted to the program. So the next form is the technical standards form, and you will have to sign this and return it as part of the application materials. But basically, by signing the technical standards form, you are stating that you possess sufficient visual acuity and color perception, which is needed to perform microscopic examinations, as well as to distinguish color reactions and detect antigen antibody reactions. You also possess sufficient gross and fine motor coordination to efficiently implement skills required in performing laboratory functions, including collection of specimens and manipulation of laboratory equipment, such as, but not limited to, glassware and electronic instruments. You also possess sufficient communication skills, verbal, nonverbal, and written, to interact effectively with individuals. And you possess sufficient intellectual, emotional, and physical functions to plan and implement laboratory duties in a responsible manner. And so if you need any sort of special accommodations to meet those standards, you can contact me or reach out to Miss Jessica Kern, who's our Student Enrollment Admissions Officer. So this form is part of your application, and it needs to be returned, signed and returned. The next form is also part of your application materials. This is the Statement of Understanding form. And basically what this form is stating is that we do require a period of assigned guided clinical experiences, and that is in the community. It's outside the college in a clinical hospital setting. So for educational purposes and practice, you will be working with live models and specimens. You'll consent in allowing other students to practice procedures on you, and you'll practice the same procedures on them, as well as those live specimens under the guidance and direct supervision of your instructors or of your clinical preceptors in the clinical setting. So of course, these are for educational purposes, so there's no guarantee or assurance given as to any problem that might be incurred as a result of these procedures and this work that we do on live specimens. The clinical experiences are assigned by the instructor for educational value, so you should not expect to earn any payment or wages. Understand that as a student within our clinical affiliates, you will conduct yourself accordingly. You will follow all required and published personnel policies, standards, philosophies, and procedures of not only that agency, but also the college itself, the Student Code of Conduct. You will also agree at your own expense to obtain all health screen tests, immunizations, criminal background checks, and drug screenings as required by our affiliating agencies for clinical rotation. You've agreed to adhere to the school's policy, rules, and regulations. Understand that any information regarding a patient or former patient is confidential and is to be used only for clinical purposes within an educational setting. And that is according to HIPAA, the Health Insurance Portability and Accountability Act. Understand the educational experiences and knowledge gained during this program do not entitle you to a job. However, if you meet all educational objectives and licensure requirements are successfully attained, then you will be qualified for a job in this occupation. And we at the college can certainly help you in locating a job. Understand any action on your part inconsistent with this information may result in suspension of training. Understand that you're liable for your own medical and hospitalization expenses, and you are accountable for your own actions. So you will carry minimum liability insurance, and typically any students who are in the health science programs, that liability fee is rolled into your tuition and fees. I think it's like $11 a semester. So again, statement of understanding, you need to sign and return that. The next form is required documentation. So this has to do with the immunization health screening requirements. Color blindness evaluation, which I also have the ability to do that on campus, because if you have some sort of color deficiency, we need to be aware of that. The professional liability insurance, I mentioned that's rolled into your tuition and fees. The hepatitis B, which is a series of 3 shots, and they are given, I think, a couple months between each other. So if you have not yet started that series, you may want to get started. Or you can sign a declination waiver stating that you do not wish to have that hepatitis B immunization series. CPR certification or recertification. CPR certification is good for 2 years. After that, you have to recertify. And of course, you can take that course through MCTC. We do offer CPR courses several times throughout the semester. A urine drug screen and criminal background check that are within 6 months of clinical rotation. And we do use a third party to take care of a lot of this. It is called Castle Branch, and it costs a little over $100 to sign up. You can get your background check, you can get your urine drug screen done, and it also acts as a receptacle for your immunization records. A 2-step TB skin test, or you can have the quantiferin drawn and tested. Measles, rubella, mumps, varicella, all of those you need proof of 2 vaccinations or a titer drawn that shows immunity. Tetanus within 10 years. And also typically the time that we were in clinical rotation is flu season. So you will be required to obtain a flu shot, or you may have to wear a mask in any areas where you are directly in contact with patients. Remember Castle Branch, and we will talk about that, but you can subscribe and get a lot of that stuff taken care of. You might have to contact your health department or your primary care physician to get your immunizations and things like that. The next form is an estimated program fees. So this tells you what our tuition is per credit hour as well as whether you are a resident, live in a contiguous county, or non-resident. Our textbook costs. Now, the great thing about the textbooks in the program is we will use the same textbook for the intro and the advanced courses. So if you choose to buy that textbook, know that you will be able to use it the following semester for the advanced courses. We also use some web-enhanced learning programs. In the program, we use an exam simulator, which is to help prepare students the final semester for the certification exam, which is a national certification exam. I've included costs for a lab coat, scrubs, and our program color is red. So I would like for students to at least have one set of red scrubs, because if we do activities on campus, also for graduate pictures, you take those in your red scrubs. And shoes. Clean tennis shoes, I don't really, they don't have to be white, just as long as they're neat and clean. Now those fees for the background check, the drug screen, you'll see those listed there, as well as immunizations and any other blood work that you might have to have done. Of course, that's variable. And based upon any blood work that comes back as non-immune, you may have to have some sort of booster added. So remember, all of those are going to vary depending upon where you get them. Miscellaneous, note-taking supplies, a timer, safety glasses, graduation expenses. There is a cap and gown and diploma cover fee. It's around $50. There is the medical laboratory technician certification exam fee. It's a national certification that you will take. It's around $215, and you are required to register for that prior to graduation, or show proof of registration. Now, you also notice there's a phlebotomy technician certification fee. I do have students who are interested in obtaining phlebotomy certification so they can get maybe a part-time job as a phlebotomist in the hospital setting. And so I've included that fee because I do have students take that exam. It's $135 if you're interested. It does require a longer clinical experience than is necessary for the MLT degree. So just be aware of that. In order to be eligible to sit for that phlebotomy technician exam, you do have to have a minimum of 100 successful venipunctures and 100 clinical hours. We do have a student organization that helps to do fundraisers and community service projects, and the funds raised used to go towards the graduate pinning ceremony for the graduates. We're able to pay for the graduates' pins, as well as any refreshments and things like that that are necessary. You'll also notice that clinical rotation transportation is on that expense list, and that is up to the student. Transportation is responsibility of the student. The first semester of the program, you have a phlebotomy clinical that will have to be done, you know, outside of class hours. And the fourth semester of the program, you have the really long laboratory clinical rotation. And those lab sites are kind of scattered around. Some of the facilities that we've used are Mercy in Batavia. We've also used Adams County Regional Medical Center, Metaview, Fleming County Hospital, Harrison Memorial, St. Joseph Mount Sterling, St. Clair. I think I may have had some students go to the St. Elizabeth facilities in the past. So we've used a variety of clinical sites. So it's quite possible, Clark Regional in Winchester, that's another one. It's quite possible that you will have to travel maybe one way an hour to get to your clinical site. So just be aware of that, and I've included that expense on this list as well. Our policy on readmission. A student can be readmitted to the program no more than 2 times. If more than 3 years have elapsed since initial enrollment in the first MLT course, then the applicant will have to repeat all MLT courses unless they're able to demonstrate current competency. So in order to be considered for readmission, you have to submit a written request to the coordinator of the Medical Lab Tech program, me, at least 1 week prior to registration for the semester the student is requesting admission, and meet current guidelines for admission to both the college as well as the MLT program. And of course, readmission is going to be dependent upon available resources. And this is a health science program. It is required that you maintain a 75 or better, a C average or better, in the program, or you will be dismissed and will not be allowed to continue. So if you've sat out a semester, then you will also have to complete a short admission application form because you haven't been concurrently enrolled at MCTC. So welcome. If you have any questions, please feel free to contact me. My contact information can be found on this webpage. And the code that you need is MCTC MLT. MCTC MLT. That counts as your verification code for the pre-admission conference verification form. And remember, I need the student data form. I will also need the technical standards form. The statement of understanding form, and if you have work experience that you would like to get credit for, healthcare work experience, I will need that form back as well as the signed form for verification that you have watched this video. So feel free to contact me if you have any further questions, and have a great day. Thank you.